materials out, okay? Another thing that I want you guys to practice doing too. Let me get caught.
Do you want me to say anything?
Why is that not with you?
I don't know.
Somebody did not clean these clippers. So what I want you guys to practice that technique, okay? When you are getting ready to place a catheter in a patient's limb, okay? You want to make sure you gather all of your supplies firsthand before you even start placing the catheter. Another thing you want to do too is rip your tape, okay? Tape is the hardest part of a catheter placement. So you want to estimate about what size the patient's leg is. Okay, I'm going to pull this first piece of tape, fat piece. I'm going to rip it right down the middle, okay? Also, pulling the tape shouldn't be difficult, but I have found in the past some students, they're like, trying to rip it. It's really easy to rip, okay? Second piece of tape, gonna be a fat piece of tape. I'm gonna make a notch in it about like that, okay? Set that on the side. And then I usually pull an extra one for the T-port, okay? So I have all 4 of my piece of tapes, okay? And I'm gonna have those ready on this side. You don't wanna be pulling the tape as you are placing the catheter, you wanna have them ready. All right, so you have the patient's limbs. Somebody would be holding off. You're gonna get your clippers, turn them on, shave the area. Ideally, you should shave all the way around the limb. When you're done with that, get rid of the hair. You want to, before this too, I want you guys to practice this technique too. I want you guys to practice flushing the T-port. There's no solution in this one, but I can put solution in it so you guys can see it. This is sterile saline, guys.
Or tap water?
I promise you it's sterile saline. Okay, so practice this technique. You would have flush in here, and then you would flush it out until there's no more air bubbles. Kind of do like that. There you go, all the air bubbles are out. And then when you open these in the package, you will also have a little cap at the end that you will keep there, okay? So you would not remove that cap. Everything has to be aseptic. Okay, I usually will leave the syringe on the end right here, and you should have a male adapter ready to attach it to the end when you are ready for that, okay? So if you lose that piece, you can also do this. That works too, okay? All right, so I have my T-port flushed. I have my catheter ready. Break the seal. Okay. This is the catheter. This is the stylet. You leave the catheter in, not both and not the stylet. It is impossible for you to leave just the stylet in there without taking the catheter off. The only way that you can do this correctly is if you leave just the catheter in there, okay? Now you hold this in a very appropriate way too. But I'm gonna keep that on the side for now. I'm gonna actually leave it open, okay? It's aseptic in there. Okay, so I shaved the area, got rid of the hair. Again, chlorhexidine alcohol, okay? I'm gonna come over here, I'm gonna hold the limb, I'm gonna do my little circles, okay? Alcohol. Like that. Just to clean the area as best as you can. Again, 3 rotations. This will be my last one. Okay, I'm done. Okay, now I'm ready to place my catheter. So the person that is holding the patient is going to be holding off on the vein. They're going to be occluding it like this, so that way I can see my vein vasodilate, okay? I palpate my vein prior to doing the scrub, so that way I have an idea. And then right when I see where my vein is, what I can't do is put my thumb there, because sometimes these veins are really wiggly. Put my thumb there so it won't move when I do insert the catheter, okay? Now, when you guys insert these, there is a very specific way that you hold them. Some people, when they place the catheter, they like to remove this back end here and put it into the catheter to plug it until they get their T-port ready. Or you can just immediately connect your T-port right after you place the catheter. There's a little wing portion to this catheter. I like to hold my middle finger and my thumb on that, and I'll hold it just behind that, so that way I'm just going to use this finger right here to advance my catheter. Bevel up, okay? So I go in slightly, and then I level out a bit, push forward. I see a flash of red. I know I'm in the vein. I'm going to stop, okay? Keep hold on your stylet, stop. Just advance the catheter. That's it. You do not advance the stylet. Do you see how it stayed in place?
Mm-hmm.
You do not advance the stylet. You remove the stylet, you could have whoever's holding off here stop holding off there and actually hold off here, like that. And again, there's two ways you could do this. You can either take this off, plug it like this, the blood will accumulate here but it won't go any further, and then go ahead and put your tape, or you can go ahead and put your T-port in, okay? So either way is acceptable. If it was this one, then that person will be holding off, and I can come over here, put this in, and then screw it in like that. Okay? It's important for you, the person that placed the catheter, to keep your thumb at the end of this catheter at all times. Very, very important, okay? And then another thing too, to verify that you are actually in, is to test the catheter itself. But first things first, I like to anchor my catheter first, okay? First piece of tape is the skinny tape, sticky side up. I'm gonna put it all the way down as far as possible, keeping my thumb at the end of the catheter, okay? Then I roll it over like that. I'll leave like a little tab like that. It anchors easier when you leave a little tab like that. Okay? I'm gonna wrap my tape around.
Are you doing it loosely or tightly or?
I am doing it comfortably. I'm not
Okay.
doing it too tight, and I don't want to do it too loose, okay? Yep, that's it. Just mark down how many minutes late. Okay? Now, I don't have to worry so much about keeping my thumb at the end right here, right? I can go ahead, I was really worried about it before because blood pressure can push the catheter back out, which we don't want. And did you see how I covered the area where my catheter is inserted in the skin? And I did not include this area here, because sometimes we have to change these T-ports, okay? So this is where I'm at. The next piece of tape I'm gonna use, the fat piece of tape with the notch, okay? I am going to push this down as far as I can with that notch sticky side down, like that. You don't want to cover that too much. There we go. And if you're nice for your future technicians, you would tap the tape. I don't ever tap the tape. Okay? So I just don't want to include this as much as I can in case I do have to change this T-port out. Then the next thing you're going to do, you're going to take this skinny piece of tape. You're going to twist it in the middle, like that, okay? And this is one that you will figure eight it. A lot of people, they'll put it down here and figure eight it. No, the point of putting this figure eight on the T-port, you see how this little L comes out? There's a little L here. You will put the tape before that L, okay? And then one piece zigzags like this. The other one will go the other way, okay? Figure eight. And then you just wrap the remainder of the tape.
Are you supposed to be covering that part right there?
This one is okay.
Okay.
Because what the point of this tape is to do is to anchor this T-port to the catheter. So there's less likelihood of it slipping out, okay? All right, and then while I'm doing this too, I want to make sure that I'm checking. So somebody, you could pull back on the syringe, and if you get blood, then you know you're in. If you are feeding it a bit, and the person that's holding here, or you yourself, if you feel here, it should feel easy to go in. You could also feel the fluid moving through the vein if you put your finger right here, okay? And then at the beginning, once you're done with that, you should ideally have it clamped the whole time, just so that way blood doesn't seep in there. The last step, I want to tape this like this, so it ends right here, okay? In order to do that, I tape the winged portion. I don't tape higher than that because remember, I have to be able to screw in the male adapter to this, okay? Another thing too, you do not want to occlude this little clamp. I'm gonna tape it over like that. Another thing too, you do not want to kink it here. Okay, last step, remove my syringe, put in a male adapter. And that's it. That's all that you do, okay? I can unclamp this, put in fluids here or here. I can clamp it up. I can detach this, hook this up to an IV line, have the patient on fluids, make sure this is unclamped, but the whole time that this is in, nothing is in it, this has to remain clamped at all times, okay? Really, really important, because otherwise blood will start to seep in here and then it'll clog this catheter. Questions?